Hello everyone, I'm Dr. Asawari Sant, and in this video I'm going to touch up on a very important topic related to women, that is anemia. Extremely common but extremely difficult to manage or treat, extremely preventable, let me say, very preventable disease, and yet so many of us suffer from it. What is anemia? Decrease in the hemoglobin content of blood is called as anemia. What is hemoglobin? Hemoglobin is the pigment which gives the red color to your RBCs. Its main function is to carry oxygen from the lungs to the tissues so that all your cells can utilize oxygen for energy, and the byproduct of that is carbon dioxide, which again hemoglobin carries back to the lung and we exhale it out. Such a important function being performed by hemoglobin, and therefore when hemoglobin is low in the blood, a lot of our bodily functions suffer and we can experience a wide range of signs and symptoms. What is normal hemoglobin? For women it is anywhere above 12 and up to 16 or 17 grams per deciliter. Too much of hemoglobin is also not good. That's a condition called polycythemia, which we will deal about maybe sometime later. Today we are talking about low hemoglobin, so less than 12 grams deciliter of hemoglobin in your blood would be defined as anemia. What are the causes of anemia and why are women so prone for anemia? Anemia has some genetic causes, but otherwise the commonest forms of anemia are acquired forms of anemia. So it could be either as a result of decreased production of RBCs or increased destruction of RBCs. You know, RBCs, the red blood cells, they have a standard lifespan. They live for a finite period of days. So if you can, if your body is destroying them much earlier than required, then you are losing RBCs and hemoglobin will go down. If your bone marrow, which is the store or the factory which produces your RBCs, is not producing enough RBCs, then also your hemoglobin will go down. And I always like to tell a story or correlate your bone marrow to your kitchen. It's easy to understand. What happens in the kitchen is a regular supply of all the goodies that the family needs. So consider those wonderful dishes as RBCs and hemoglobin. If your kitchen has to function well, then your store has to be very well stocked. If you suddenly get an unannounced guest, so what do? You increase the number of, the amount of rice you're going to cook or the amount of dal. You don't add water to the dal. That's because you have enough in your store to make one more, more food. Similarly, if your stores are good, then whenever there is an unannounced guest, what do I mean by that? Something which is increasing the demand for blood. So it can be pregnancy, it can be lactation, it can be menstrual loss of blood, it can be loss of blood because of, say, a fibroid, so you are having heavy periods. So any of these causes which lead to increased demand, if your stores are good, then you can manage it well and you will be able to make a gadi dal. You will not make a patli dal for your guests. Same applies for hemoglobin. So this was a simile which I like to give. Now, how will you maintain a good store of the nutrients required so that your bone marrow goes on producing enough amount of blood is to keep your diet and nutrition good. So what are the two key elements required to produce blood or RBCs is iron, obviously, and then the two vitamins, that is vitamin B12 and folic acid. So the nutritional forms of anemias are mainly because of deficiency of iron or B12. Non-vegetarian people are very lucky. They don't usually suffer from deficiency of these unless, of course, if they have worms. In that case, though their diet is good, they cannot utilize all that because the worms are utilizing all the nutrients. But otherwise, because in non-vegetarian food, iron is available in a form called as heme iron, and that's very easily absorbed. It doesn't require any special thing to be done. Even B12 is in good amounts in non-vegetarian food, so you don't really need to worry. But vegetarian people, and especially in India, we have many communities which go on prolonged fasting or may be just malnourished. So in addition to the increased demand put on women because of their menstruation, pregnancy, lactation, periods of growth, you also have this tendency to go on a fast, or nowadays even the tendency to go on fad diets or crash diets. This is also really messing up all your nutrients in the body and making you more prone for anemias. So this was the part where production of RBCs goes down because your nutrition is not good. So that factory is not functioning to the optimum level. Another thing that can happen to that factory or the bone marrow is that it may not be getting enough stimulation to produce the RBCs. So it is basically a bone marrow which has depleted its capacity to produce RBCs, and that kind of anemia we call as aplastic anemia. That's a very special type of anemia that also can, so usually we see that in very high dose antibiotics or chemotherapy or radiation given to a patient, or sometimes side effect of fertilizers and pesticides which are there in our foods, and if a particular person is exposed to that as a result of their occupation. So this was about decreased production. What about increased destruction? So RBCs can get destroyed in your blood as a result of hemolytic anemias. That's a separate category of anemia. Now in the given time of this video, it is impossible to cover all the forms of anemia. So let's just focus on the two important nutritional forms of anemia which are common in women. Iron deficiency anemia, commonest form, and then you have the B12 deficiency anemia as well. So iron deficiency anemia is the most common form of anemia at least in Indian women, and causes could be bad diet, or it could be a very important point you have to remember is too much of drinking of tea or eating supari. It interferes with your absorption of iron. So though your diet may be good in, say, all the green leafy vegetables which are high in iron content, but if you have the habit of drinking too much tea or you're continuously eating supari, it's going to interfere with the absorption of iron. I also like to tell on my whenever I go for talks is that you must wash your green leafy vegetables before you cut them, not cut them and then wash them. Also try to cook in iron kadhais with iron spatulas so that you have or an iron tawa. Easiest ways to avoid iron deficiency anemias is to eat a handful of peanuts and jaggery, or our standard diet of brinjal vegetable and bhakri, very very good for iron deficiency anemias, and all your green leafy vegetables of course. And like I said, non-vegetarian people will not have a problem. What about B12 deficiency? It's a little more complex. It causes not only anemias but also neurological problems, and it also causes some increased risks of heart disease as well. So it's a complex kind of an anemia which you get. But B12 also, if you want to have a good dietary sources, again non-vegetarian sources are better, but if you can't get it through your diet, definitely a supplement of Bicosools is any of your B complex vitamins under the guidance of your physician should prevent the formation of anemias as a result of B12 deficiencies. What are the symptoms of anemia you will look out for? It could be just a tiredness or palpitations while climbing stairs, inactivity, no energy to do anything, or you feel like not very enthusiastic. You're continuously trying to avoid going out with your friends because you feel you just want to be at home. Any of these could be signs and symptoms of anemia. In addition to that, obviously a pale tongue, or if you pull down your eyelid, you'll be able to see that it's not really pink or red, it's looking much paler. Your nails could become concave instead of convex, which we call as spoon-shaped nails. A peculiarity of iron deficiency anemia is that you will feel like eating ice or clay. So this we call as pica. In B12 deficiency anemias, you might get a yellowish tint to your skin, and you might get, at the angles of the mouth, you could get some ulcers, or even ulcers on the tongue and in the mouth, very, very commonly seen in B12 deficiencies. So these are your symptoms which you must look out for and seek medical help, do a hemoglobin test, find out which type of anemia you have, and it's easily preventable and definitely easily treatable.